Hi, I'm Amy. Today we will discuss Bayer's new approach to retiree health care coverage. On behalf of Bayer, I'm pleased to be joined by Rob Clark from Extend Health, our partner in helping you through this transition. Today we will cover what is changing, along with why things are changing. We'll also discuss the Health Reimbursement Account, or HRA, that some of you may be receiving if you currently receive subsidized coverage from Bayer. Next, Rob from Extend Health will help you understand your supplemental Medicare insurance options. We'll then move on to your next steps and some frequently asked questions and answers. What is changing for 2013 for you as a Medicare-eligible retiree? Effective January 1st, 2013, your Bayer coverage will end. Instead, you will buy coverage in the individual marketplace. If you are eligible, Bayer will help you to pay for this coverage by contributing to a Health Reimbursement Account, or HRA. Extend Health will help you evaluate, select, and enroll in your plan. Between now and December 31st, 2012, your current coverage remains the same. You will continue to use the plan as you do today. Most Bayer retirees who retired since 1984 are impacted by this change. Retirees prior to 1984 and certain union legacy groups will not be impacted by this change. Sometimes, with a change like this, you may become concerned about a disruption in care from a pre-existing condition. There will be no disruption to your care because of this change if you are currently receiving treatments. Be sure to enroll by December 31st, 2012, which is the end of the special enrollment period for Bayer retirees. If you enroll before December 31st, 2012, pre-existing medical conditions will not prevent you from receiving coverage. Why are we making this change? The market for individual Medicare supplemental health plans has grown. Now, the individual market offers a variety of medical, prescription drug, dental, and vision plans. These plans have come down in cost. The lower cost of these plans is due in part to subsidies provided to Medicare plans. The move to the individual market offers enhanced value, flexibility, choice, and personalized support for retirees, their spouses, dependents, and surviving spouses. As we discussed, some of you who are currently receiving subsidized health care coverage may receive a Health Reimbursement Account, or HRA, from Bayer. With the HRA, you can be reimbursed for the cost of health care you purchase in the individual market. If you are eligible for the HRA, your HRA amount will be listed in a cover letter that will accompany your Extend Health enrollment guide. It is also available by phone from Extend Health benefit advisors. The amount of the HRA ranges from $1,200 to $1,800 annually. The amount you receive will be based on your age and years of service at retirement, or it will be based on your acquisition terms. The amount will be adjusted by the Consumer Price Index annually. Extend Health will describe the HRA in more detail later in this presentation. Now I'm going to turn the presentation over to Rob from Extend Health. Extend Health is a leader in helping Medicare-eligible retirees find and enroll in supplemental health care coverage in the individual market. Extend Health has licensed, trained advisors who provide personalized, expert support. You will work one-on-one with Extend Health benefit advisors during the enrollment process and ongoing. Extend Health's expert services are provided by Bayer with no cost to you. Rob?
Thank you, Amy. My name is Robert Clark. I'm a benefit advisor here at Extend Health. I'd like to thank everyone for joining us and for listening. I'd also like to point out that I know a lot of you may be concerned. You may be wondering what will happen to your health insurance. We are the experts in Medicare, and you now have an expert in Medicare in your corner. Extend Health has helped hundreds of thousands of retirees such as yourself make this transition. We've partnered with over 75 different insurance companies to provide selection, to provide variety, and to provide plans that will meet your budget. We have objective and trusted benefit advisors. Their job is to make sure that you get put in the plan that is best for you. Most group plans nowadays only offer one or two options. It's a one-size-fits-all. Extend Health has 75 different insurance companies that we work with to make sure that we find a plan that fits your needs and fits your budget. We're focused on helping each and every one of you make an informed decision and feel confident with that choice. We've helped hundreds of thousands of retirees make this transition. Not only that, as Amy mentioned, this is at no cost to you. So whether you call in one time, whether you call in 30 times, there is no cost. We want you to feel comfortable with this choice and with this transition. We actually had a gentleman call in last year 63 times. Whether it takes one time, whether it takes 63 times, we will take as much time and as much effort as you require to make sure that you feel confident and comfortable with your choice. I'd like to point out some of the companies that we've helped to make this transition. A lot of these companies you'll recognize. They're household names and trusted brands. We've helped Ford, General Motors, Dole, Caterpillar. These companies and these retirees, we helped make this transition in the past, but we still work with those retirees because, as we all know, health needs are constantly changing. The same with you as Bayer retirees. We know that we will help you with this transition right now, but we will be here for the future as well. We know that your health needs and your prescriptions may change in the future, so we are here for you now, and we will be there for you in the future as those changes occur. I'd also like to go over some of the insurance companies that we work with. This is not a comprehensive list. This is just an example, a short list so that you can have a general idea of some of the insurance companies that we will be providing. We provide plans from AARP, from Anthem Blue Cross and Blue Shield, from Cigna, from Aetna, from Coventry, Humana, Secure Horizons, Unicare. We also offer a dental plan from Delta Dental and a vision plan from BSP. The current coverage you have right now, you have your Medicare, you have your Part A and your Part B, and then you have your group plan. So what is changing? Your Medicare Part A and your Part B will stay the same. That is not going anywhere. What will happen is the group plan you have will transition to either Medigap or Medicare Advantage. Your Medicare will stay where it is. The group plan will transition to one of those two categories. And then also you have the option to take a Part D drug plan and also a vision or a dental. So you'll have either a Medigap option, a Medicare Advantage plan. You'll have the option to take a Part D drug plan and then a vision or a dental plan if that's what you'd like. I'd like to point out the Part D drug plans. It has been encouraged in the past to stray away from those, but that has changed due to recent flexibility and the coverage that they provide. So we highly encourage you to not let that past suggestion influence your decision for the future when you're making a drug plan selection. I'd like to go over the difference between a Medigap and the Medicare Advantage. If I were you and I were taking notes, what I would do is I'd write a line right down the middle of my piece of paper, a vertical line. On the left-hand side, I would write down Medigap or Medicare Supplement. And then on the right-hand side, I'd write down Medicare Advantage. Those are your two options that you'll be able to choose from. Each of those two options has many, many different plans, but that will be up to you and the benefit advisor to select which of those plans is best for you. A Medigap plan provides a lot of flexibility with no restriction in your network coverage. With a Medigap plan, you can see any doctor anywhere in the country that accepts Medicare. So if you live in New York and you travel to Florida, or if you travel to California, you can see any doctor there as long as that doctor accepts Medicare. About 95% of doctors accept Medicare. A Medigap plan has very little out-of-pocket expenses. That means when you go to the doctor, when you go to the hospital, you pay very little out of your pocket. In most cases, there's no copays or deductibles. A Medigap plan does not have a drug plan built into it. This is where a Part D drug plan would come in. If you decide to go with a Medigap, you take a Medigap plan from one company and a separate drug plan, a Part D, to go with that. Medigap plans typically have a little bit of a higher monthly premium than a Medicare Advantage. because with a Medigap plan, you're paying a higher premium to have the plan, but when something does occur, you're paying very little out of your pocket. Please keep in mind, if you do decide to go with a Medigap plan, that you will need to pay the first month's premium when you sign up on that plan. The next category I'd like to go over is a Medicare Advantage. A Medicare Advantage plan is different than a Medigap plan because you have networks. Those networks typically consist of an HMO or a PPO. I'm sure a lot of you are familiar with HMOs and PPOs, but I'll just briefly cover what those are. An HMO is a plan where you have in-network benefits. You have a list of doctors, and your doctor has to be on that list. If your doctor is not on that list, you cannot see that doctor. A PPO is a preferred provider organization where you have an in-network benefit and you have an out-of-network benefit. If your doctor is in-network and on that list, you pay a discounted copay. If your doctor is not in that network, you pay a higher copay, but you can see doctors out of that network. If you decide to go with a Medicare Advantage plan, you will most likely be put into either an HMO or a PPO. That will be your choice. Medicare Advantage plans are more a pay-as-you-go plan, meaning you have copays and you have deductibles. With a Medicare Advantage plan, you'll typically have a lower monthly premium than you would with a Medigap, but with a Medicare Advantage plan, you pay more out of your pocket for services, for doctor office visits, for hospital stays, for copays. A Medicare Advantage plan does have a drug plan built into it, so it has the Part D coupled together with the medical under one plan. A Medigap plan, you have a higher monthly premium, but you pay very little out-of-pocket expenses. It does not include a drug plan, so you need to get a separate drug plan to go with that. A Medicare Advantage plan, you pay a lower monthly premium, but you pay more out of your pocket as those expenses occur. And a Medicare Advantage plan does have a drug plan built into it.